1949 year. The most prestigious scientific prize in the world, the Nobel Prize, is awarded to the Portuguese António Egas Muniz for his innovative method of surgical treatment of mental disorders. Leucotomy, better known as lobotomy. The fashionable operation is performed all over the world by tens of thousands a year. It is considered a panacea for everything from depression to homosexuality. In this issue, we will tell you about one of the most shameful periods in the history of psychiatry. You will learn how the US became infatuated with lobotomy, how it turned from a last resort to a routine operation that was performed right in a special van for 6 minutes and $25, how lobotomy ruined the life of President Kennedy's younger sister, and what made the medical community finally abandon this horrific practice. António Egas Muniz is a well-known person in Portugal, not only as a doctor, but also as a politician and even as a minister of foreign affairs. Having finally left politics at the age of 46, he returned to science and took up neuroscience. And in 1936, he published his most famous study, a report on performing a frontal lobotomy on a person with mental disorders. Muniz was inspired to come up with this idea by a presentation by his American colleagues, John Fulton and Carl Eli Jacobson, at the Second International Congress on Neuroscience in 1935. In the 1930s, Fulton worked extensively on the study of the brain, not of humans, but of primates. He once obtained an interesting result. If the frontal lobes of the chimpanzee brain located behind the forehead were removed, the aggressive monkey became much calmer. However, Fulton himself was in no hurry to draw any loud conclusions and did not support human experiments. But Muniz was very inspired. He performed the first operation on a 63-year-old woman who had long been treated for depression and anxiety disorder. At that time, psychiatrists had not yet been able to treat such conditions with medication. The advent of antidepressants was a couple of decades away. Instead, doctors used electroshock therapy, passing an electric current through the brain. But it helped only slightly and not always. In this context, the idea of operating on people with mental illness did not seem strange. Besides, it was assumed that the frontal lobes themselves were not damaged. Only the white matter, the fibers that connect the frontal lobes to other parts of the brain, was cut. So Muniz performs his first surgery. Strictly speaking, it was not performed by him, but by his colleague. Muniz himself suffered from gout, and his fingers did not obey him well. The surgeon, Alme Dalama, drilled holes on both sides of the patient's frontal skull, poured half a teaspoon of ethyl alcohol into the frontal lobes and closed the holes. Muniz reports that the operation was successful. He operates on several other patients, aged 22 to 67, with various diagnoses: depression, schizophrenia, manic depressive disorder. The technology was soon changed. Instead of injecting alcohol into the brain, doctors now inserted a long rod with a wire loop at the end into the patient's skull, which was used to extract parts of the brain tissue. According to Muniz's reports, 7 out of 20 patients showed significant behavioral improvements after surgery. 7 showed minor improvements, and 6 remained unchanged. There were side effects such as dizziness, apathy, incontinence, and inadequate perception of reality. But doctors did not pay much attention to this because, according to them, people's legal capacity was generally preserved and their behavior became consistently calm. Muniz wrote a large scientific paper about his first patients. In it, he made an unequivocal conclusion that his method was a breakthrough in psychiatry and neurology. Many of his colleagues objected that the operated patients did not become full-fledged people. On the contrary, they definitely degraded. But despite these objections, lobotomy was rapidly gaining popularity. Lobotomy could have resulted in significantly fewer victims if Muniz's idea had not been picked up by American neurologist Walter Freeman. After learning about his Portuguese colleague's experiment, Freeman took up surgical instruments for the first time in his life. Together with neurosurgeon James Wads, he began performing lobotomies at a record pace. According to him, 98 of the 136 first patients underwent surgery began to feel much better, and only 3 died during the procedure. Yes, Freeman considered such nuances quite acceptable. Freeman and Vodet's successes were reported in major American publications. Freeman's skillful marketing and optimism made lobotomy fashionable. One of the most famous victims of this fashion was Rosemary Kennedy, the younger sister of the future 35th President of the United States. The girl had mental problems since childhood. She was clearly retarded, most likely due to hypoxia at birth. Rosemary spoke and read poorly and had mood swings. And although she was quite adapted to everyday life, the presence of a child with special needs hurt the father of a huge family, Kennedy. It was on his initiative that 23-year-old Rosemary was brought to Dr. Freeman in 1941. Rosemary was operated on as usual during a lobotomy under local anesthesia. It was important for the doctors to talk to the patient. Young Candy was asked to recite prayers and count backwards. At this time, her brain was cut through holes on both sides of her head. When the girl's speech became incoherent, they stopped. The operation undoubtedly had a result, but it was negative. According to doctors, the girl's intelligence was at the level of 8 to 12 years old before the surgery, but after it, she was at the level of a 2-year-old child. Rosemary had to learn to walk again, and her speech and thinking were not restored. Rosemary would never know that 8 years later, the inventor of the lobotomy would win the Nobel Prize. Shortly after the operation, she would be admitted to a private psychiatric clinic and later to St. Coletta's school in Wisconsin, from where she would never leave. Surprisingly, the failure of the operation did not disappoint Freeman at all, saying that it was nothing to worry about. Perhaps if the Kennedy family had publicized Freeman's failure, his activities could have been stopped. But the elder Kennedy was a well-known politician and did not want to damage his reputation. The consequences of Rosemary's lobotomy were hushed up for many years. As Freeman's experiments continued, he decided to go even deeper into the brain. Previously, he had worked with Monish's invention, a syringe-like intrusion called the leucotome. A narrow rod was inserted into the brain through a hole in the skull. A core, a wire loop, was pulled out and part of the brain was cut out. Sometimes the leucotomes broke right in the patient's skull, unable to withstand the load. Freeman decided to improve the technique, and his attention was drawn to an ice pick. Once he performed a lobotomy with it, driving the sharp tip into the bone on the upper inner side of the patient's eye socket with a hammer so as to hit the frontal lobes of the brain. In 1948, Freeman developed his own instrument, the orbitoclast. Thanks to it, there was no need to make holes in the skull, but operations were now performed completely blind. The surgeon could not see what exactly he was cutting with his ice pick. But now, Walter Freeman could perform surgeries much faster, and the number of patients increased many times over. His partner James Watts, unable to accept his colleagues' cruel methods, stopped working with Freeman forever. In 1950, lobotomy was at its peak. Most operations are performed in the United States, up to 5,000 a year, followed by Britain and Scandinavia. To speed up the process, Freeman decides to perform lobotomies not in the operating room, but in any convenient place. Yes, you heard right. Freeman creates a lobotomobile, a van in which he travels to patients and performs operations under local anesthesia. On average, 1.5% of patients died during or after such an intervention. But this did not bother Freeman or those who came to him. While Moniz still considered lobotomy to be the last resort, Freeman was ready to use it in a variety of cases. Thus, lobotomies were used to treat homosexuality or simply the patient's behavior that was considered reprehensible by relatives. Walter Freeman's van traveled 138,000 kilometers across the United States. He stopped by hospitals and mental hospitals, performing record-breaking surgeries. He spent an average of 6 minutes on a single lobotomy for only $25. There were no age restrictions. The youngest patient was only 4 years old. The massive interest in lobotomy can be explained by the growth of mental illness. In the 40s and 50s, approximately as many patients with mental disorders were hospitalized in the United States as patients with all other diseases. Specialized hospitals resembled a concentration camp and could not offer humane treatment. So people saw lobotomy, which was cheap and quick, as a simple solution to all their problems. Freeman promised to make people with aggressive antisocial behavior calm and peaceful. Those who suffered from anxiety, depression, paranoia, or manic disorders, good-natured and joyful in life. The press also added fuel to the fire by publishing good articles. Freeman claimed that the vast majority of lobotomy results were successful. However, an objective assessment of the operated patients proved that Freeman was either lying or deeply mistaken about what constituted success. In reality, even the cases when the operated patient was at least not worse were miracles. Presumably, during a blind operation, they simply did not hit important parts of the brain. In general, even those whom Freeman considered cured showed a sharp personality regression. At least a quarter of the patients were not even able to leave the hospital after the operation. And those who returned home often could not take care of themselves. They had memory lapses, could no longer work, and suffered from bedwetting. However, now, this did not really bother them. Most lobotomies were performed in the United States until the 70s, with 40 to 50,000 operations performed there. In the UK, 17,000, in 3 Scandinavian countries, Finland, Norway, and Sweden, about 9,300. Despite the fact that almost all of his colleagues turned their backs on Walter Freeman over time, he continued to perform operations until 1967, when his last patient died of a brain hemorrhage. This was not the first time Freeman had gone blind and damaged the blood supply to the brain with his ice pick, but it was the last straw. Freeman was finally stripped of his license to practice medicine. In the United States, lobotomy was finally abandoned only in the 70s, but in some countries it was still performed in the 1980s. The last country to ban lobotomy was France.